I think I could ask you, why did you learn the stethoscope? And you'd tell me that it was a tool to give you more information. Well, ultrasound's pretty much the same thing, we've just moved on a century. It's a tool that gives us more information about the patient. Technology has come such a long way even in the last 15 years, and the pictures have become clearer and clearer. The reason I learned ultrasound was because we needed the extra information. The reason you folk should learn ultrasound, I think, is to just keep pace with the change in technology. It's expected of you. You can't afford to be behind the times. I've taught ultrasound for many people in many places, and whatever makes or breaks the course is your models. The thing that I like most about it, other than the beach, is the volunteer base. You need to have models that you can scan without counting the minutes, and that is the best thing about the AIU, is a wonderful volunteer base. Having patients who are very helpful and very kind, are quite used to the procedure. We also get some patients with pathology, and that's actually very important for your credentialing and your ongoing learning. You have to actually be able to scan someone with a AAA or someone with lung fibrosis or someone with heart problems, and that you can practice on. Because honestly, there's only so many medical students and you really can't keep scanning them. That's what I like about the AIU. We've been redesigning the curriculum, and we're starting to really pay attention to the different facets of learning ultrasound. Now, sure enough, you can learn a bit about interpretation off the internet. You can even get some integration off the internet, but there's no way you can learn off the computer the actual hand movements and how you adjust your hand to get the right pictures. So when you come to the AIU, you also have some really experienced sonographers who've been teaching us for years, help you get exactly the best pictures you possibly can. We also talk about the interpretation, and we're getting more and more into the case discussions and the integration. But above and beyond that, the thing you get when you come to a course is discussion. You get to meet other people from similar circumstances to yourself. You can swap ideas. You develop a support network, really. That's the important thing, I think, that you can get from coming to the AIU. The best thing we have is that our teachers are experienced. They have been doing this for quite a long time, and they're quite adept at picking up the little faults that you may think is not really relevant, but little things like the weight of the cord pulling people's probes off alignment. An experienced teacher will just be looking at the screen, and they can tell what you're doing with your hand by what's happening on the screen. And they can guide you with your hand movements or with your general acquisition, because they've done it so long for so many people. So the AIU isn't just about teaching doctors and sonographers, it's about teaching nurses and paramedics and physiotherapists, because we can all use this tool.